Some new data from the CDC shows that black women in the U.S. are 3 to 4 times more likely to die from pregnancy-related causes than white women. And black infants are 2 times more likely to die in their first year than white infants. Now, advocates say investments in maternal health is the key to addressing this deadly crisis that overwhelmingly impacts women of color.
Monique Simone Shaw with the Robert Wood Johnson Foundation joining us live now to break down this report. Monique, what is driving America's maternal mortality crisis?
Yes, thank you so much for having me. Unfortunately, the United States is one of the most dangerous high-income countries in which to give birth, with pregnancy-related deaths on the rise based on the latest CDC data. And there are a lot of reasons or root causes, particularly behind the disparities that we see in these outcomes. And unfortunately, racism and discrimination within the healthcare setting is one root cause. In addition to that, there's just a widespread lack of access to healthcare coverage and quality maternal and child health care, particularly care that is compassionate, respectful, and that also is delivered in a cultural, that's delivered with cultural humility.
So you touched on it a moment ago, but why are people of color seeing such higher maternal mortality rates?
Yeah, there are lots of reasons. Unfortunately, because of the way that our healthcare system is set up, it places more value on some lives than others. And that is based on race and class. And there are just too many families that don't have access to quality maternal and child health care. And so really this crisis is perpetuated daily by America's failure to provide accessible, quality, and affordable health care coverage to everyone, including Black moms.
And I coincidentally have examined some of that CDC data, and it seems to suggest that women of color, especially Black and Hispanic women, are opting for either at-home births or births in birth centers. Do you think this is then a response to the way they're being treated in hospitals?
I do think that is the case, but the reality is that people in this country, all parents deserve a beautiful and healthy birth experience that aligns with their own values and needs, and that people should have access to care and to support in whatever way in which they'd prefer.
So what can we do about it? Are there policy solutions available?
Absolutely. So the great news is that over 80% of these deaths are preventable. And while this is a complex issue, it warrants more than just one solution. It's important for sectors to work together across philanthropy, healthcare, and the government to make sure that all who are giving birth have the chance to have healthy pregnancies and babies. And to get there, the most important step that I think that we can take right now toward that goal is to close the Medicaid coverage gap. Nearly half of all births in this country are covered by Medicaid, and 65% of those births are to Black women. And so Congress has not only the authority, but also the responsibility to enact a federal solution that ends this injustice and protects all mothers and children.
Monique Simone Shaw, thank you so much for joining us today.
Thank you so much for having me.